My name is Brad Duhon. I'm a board-certified neurosurgeon. My areas of interest and specialty are minimally invasive spine surgery, motion-preserving spine surgery, and sacroiliac joint dysfunction. In a neurosurgery training program, we focus on the head, we focus on the spine, and we focus on peripheral nerves. So that's kind of within our purview is cranial, spinal, peripheral nerve. Most patients we see aren't necessarily surgical. Patients are looking for reassurance, and a lot of times we can provide that reassurance, taking the entire clinical picture. So we have patient symptoms, we have physical exam, we have diagnostic studies such as imaging, etc., and bringing all of that together. And then once we have all the appropriate data, it makes it much more appropriate and honestly easier for us to make a real recommendation. Sometimes we gather all the data and spine surgery is not on the table. It's not an option. Or sometimes what we have to offer just carries too many risks or not enough benefit. But where we separate ourselves here at Boulder Community is the ability to have that conversation with the patient and function almost like consultants, so we can lay out the risk and benefits of an intervention or the risk and benefits of not intervening and help that patient make the appropriate choice. For many years of my life, I've been pretty married to what I do. I won't lie to you. Like as a neurosurgeon, I spent my entire career, this is what I want to do. I decided I was going to be a surgeon in the 7th grade. I never wanted to do anything else. So I love what I do. But when I'm not here, got a wife, I've got 2 wonderful kids, and I enjoy spending time with them. We enjoy skiing and mountain biking and hiking, and it's all the Colorado stuff. That's the reason why we're here. I've got a lot of family in Texas as well, so whenever I get the opportunity, we will hop on a plane, we'll head back home to Texas, and I'm bringing my son bass fishing with my dad here in the next few weeks. So anytime we can to get outdoors, spend time with our family, that's certainly what we try to do every chance we get. We neurosurgeons go into surgery because we love to operate. Everyone knows it's my happy place. Like you surround yourself with an excellent team, and when you do the job and you do the job well, it's an incredible feeling when surgery goes well. That being said, I really try to distinguish myself because I actually really enjoy the clinic aspect of it. I enjoy meeting with the patient, going over imaging, discussing the diagnoses, discussing treatment options that we might have. Nothing brings me more joy with my job than having a patient saying, I've had this for years, I've seen half a dozen specialists, and no one has ever explained it to me the way you have. That is a big part of what I do. That's a very important part of what I do, and I take pride in that part of my job. It's pretty hard to beat.